Welcome everybody to this session of healthcare. We're with Junior Leadership Lake Norman and the adult version of Lake Norman, Leadership Lake Norman. It's disappointing we can't do the actual tours that prior classes have been able to go over to the hospitals and tour the whether it's Novant or Atrium. But we put together a great program today from 2 o'clock to 4 o'clock. It's going to be a panel discussion, at least in the first hour. And we have Kewanda Thompson, Emilee Mcelroy, and Lisa Loll, who are graduates of last year's leadership program that is overseeing this year's program, and they put this together. So we're looking forward to that. And if you're from the Leadership Lake Norman program, we encourage, if you can, at 5:30, we're going to be at Lost Worlds Brewing here in Cornelius over at 1 Norman Square, and just having a little social hour. So if anybody can join us afterwards, we'd love to have you. If you feel comfortable, bring a mask because we want everybody to be safe. People are still signing on, and I'm going to go ahead and continue to let them in. But Kewanda, I think you're going to be emceeing our panel discussion, introducing our speakers. So I'm going to toss it over to you.
All right. Thanks for having us. Today we have a great panel and to talk about a lot of things centering around COVID-19. Challenges, where we're going, what we're seeing, vaccines, and the whole nine. And I'm going to start by introducing our wonderful panelists. We'll start with Lisa Loll. She's my previous cohort from last year. She is with Novant Health, Huntersville Medical Center, and she's a nurse manager. We also have, is Allie Moody on? Is Allie on, Lisa?
I am.
All right. Allie, she's with Novant Health, Huntersville Medical Center as well, and she's our director of nursing. We also have Mr. Mike Riley. He is with Novant Health, Huntersville Medical Center, and he's the president and COO. And I was told, Mr. Riley, that depending on your schedule, you may have to hop in or out. So what you can do is just join in whenever I'm asking Lisa or Allie a question. If you want to chime in with something, feel free. You get to freelance doing this panel.
Okay, but 90% of the time they have a better answer than I do anyway, so that's fine.
Okay, I'll take that. And then on the side of Atrium Health, we also have our very own Dr. Catherine Passaretti. She is Atrium Health's medical director. And then I also have Mr. Chris Bowe, Atrium Health SVP and president of our Northeast market. So we will get started. All right, and thank you all for being here. I know you had to rearrange your schedules for us, and I appreciate it. We'll start with Lisa. The first question I'll ask, what has been the impact of the pandemic on your team? What has been the impact of the pandemic on your team?
I think last year at this time, you told me that it'd be still another year. I would have said, no way. It's been a very long year. We frontline nurses, CNAs, and our providers are tired. We work in the emergency room. I don't know if we made that clear at the beginning. I'm the manager for the emergency department here. And, we've been working hard to not catch the virus ourselves. So just like you all, we all have family stressors, just like you do. We have kids in remote learning. We have financial struggles, just like everyone else. We have COVID fatigue. We want this to be over with more than anyone else, I think. Our skin is breaking down across the bridge of our nose, over our ears from those N95s. We wear a lot of PPE that's hot and we sweat. Those plastic gowns, the N95 and gloves and headgear, it's all very hot and cumbersome. We struggle to communicate with our patients because of the barrier of the mask, add the plexiglass, add hearing impairment. And you realize, wow, I really used to look at lips and capture what people were saying. And so there's a lot of communication errors and communication struggles, and that's made it difficult as well. So that's kind of the effect the pandemic has had on us.
Okay, and Allie, I'll just jump straight to you to continue with that. What do you believe are the benefits of receiving the COVID vaccination?
So, obviously to like what Lisa Loll said, I think that's a key component to being able to move past this pandemic and getting it under control and be able to get back to some normalcy. I don't think we'll necessarily ever get back to what life was before the pandemic, right? Like, I think there's definitely some things that we have made some changes on that will be lasting changes, but certainly the vaccine it is a way to get past that. But also, I believe there's so many unknowns with the virus, right? Like, that's one of the most difficult parts of being able to combat this. You don't know who it's going to impact the hardest. You don't know what the lasting effects are going to be. You can't identify who truly the high risk people are, because I mean, we're even seeing young, healthy people that are having issues and even not surviving this virus. And so for me, even with some of the unknowns we may have with the vaccine, which I think are much less, it's still more predictable what some of those side effects or things are going to be. And so I think just looking at in medical profession, we always look at risks and benefits, right? I think the benefits of that vaccine, with both getting us past this pandemic, but also having the known versus what's unknown with the actual virus, is much more of a benefit than a risk. And then the other piece is, even if you do survive the virus, like knowing what those long lasting impacts and effects are going to be, again, is another unknown, right? And so for me, it was a no-brainer for me when I looked at the data, when I looked at the research from a efficacy and a safety standpoint. It made much more sense from a risk and benefit standpoint to take that vaccine, be able to take a step closer to moving past this, be a part of the solution, versus, not having that knowledge of what could potentially happen if I were to get the virus, or even spread it to my family members. I have a 93-year-old Nana, right? Like, I haven't seen her more than 3 times in the last year. I want to be able to see her again. I want to be able to hug her without being fearful that I'm going to give her something that would ultimately probably end up in her death.
Okay.
So for me, that's the benefits of the vaccine.
Okay, before I go to Dr. Passaretti, Mike, would you like to add anything to what Lisa and Allie have said?
Sure. And really, Ali said it very well. I think if you look at the risk of getting COVID and then the risk of the damages it could do to you personally, and then the risk of spreading it to other people, that risk is significantly higher than any risk you could take from having the vaccine. So that if you're going to weigh your risk one against the other, getting COVID and spreading COVID is 1,000 times worse than any side effects from the vaccine that there may be. So yeah, and to Lisa's point, yeah, I think everybody in the world is tired of COVID, but the healthcare folks are 10 times more tired of it because they're seeing it every single day. So it affects the people who work in healthcare more so because they're seeing it every day, but they have to deal with all the same things all of you have to deal with your kids going to school and figuring out how to work that out and not being able to see your family. So they're dealing with all that, and they're seeing the patients who are coming in with the disease every day.
Okay, thank you. Speaking of the vaccine, Dr. Passaretti, mutated strains of COVID are the hot topic of the week. What are they? What impact could they have? And will the vaccines work? It's a loaded question.
Oh, sorry. Yeah, and you all probably have seen the news coming through today that 2 cases of yet another variant strain of COVID were first identified in the United States, not too far from us in South Carolina. So over the past, say, 3-4 weeks, I'm sure y'all have heard that there have been a number of variants of concern of COVID. So all respiratory viruses kind of change slightly over time. It's how they adapt, how they survive. And usually those changes are minor. And until now, the changes to COVID have been relatively small and not had any clinical significance. But the strains more recently are making more significant changes and have been associated with, the one that has been seen the most seems to have started out in the UK and has been associated with very, very much higher transmission from person to person. So if, normal COVID spreads from 1 infected person to 2 susceptible people, the variant strains may now spread to 4 susceptible people. So more people infected, even though, it's not clear that these strains are associated with higher severity of illness, say, more people infected, more hospitalizations, more deaths than we've already seen. So, I think doubles down on the importance of getting this pandemic under control as soon as possible. So the UK one, fortunately, the studies that have been done so far, it seems like the vaccines that are available right now will be effective in keeping that under control. The other strains that you've heard about, one from South Africa and one from Brazil/Japan, those ones have a little bit more significant changes to the virus and, are chipping away a little bit at our control measures. So all of them spread a little bit more easily from person to person. And the latter two, it does look like there's possibility that the vaccine may not be as effective, still effective most likely, but not. The current vaccines are thought to be 95% effective in protecting the vaccinated person from developing symptoms and illness with COVID. So instead of 95%, it might be 85%. So still worthwhile getting the vaccine, absolutely. But know that, if we do not get this pandemic under control, that means, vaccinating a whole lot of people, and for now, continuing masking, distancing, all the preventive measures that we've been preaching for a while, then those mutations may continue and completely escape the vaccine. And then we lose control again and we start this cycle over. So this is our window to act, to get vaccinated, to really kind of get things under control. And, certainly we are learning every day that this virus is a gift that keeps on giving, right? There's something new to be learned. There's some new clinical presentation. There's some new twist on things that we have to adapt and flex to keep things under control.
Okay, thank you. Chris, I will go to you now, and I'll ask you from a personal perspective, can you share the tie between distribution and the impacts on frontline teammates?
Yeah, thanks, Kewanda. And I'd say thanks, Bill, for pulling this together and inviting us to do this. And then secondly, for me, thank you to the Novant team, because, we find ourselves to be competitors in some environments and partners in others. And this is definitely an environment in which we just don't have enough of all of us to really do what we need to do. So thank you all for what you're doing. It's interesting, Kewanda, for me, the personal perspective is and I'm sure Mike has the same experience, is, when I round on our teams, and to Lisa's point earlier about the burden and the duress, our teams are, it's incredible to walk into an ICU environment or any environment today, because COVID is throughout all of our facilities, and see our teams selflessly commit themselves in this highest risk moment. It's the most inspirational thing I've ever, and most humbling thing I've ever witnessed as a leader. And then to couple that with this past weekend where Atrium Health was able to vaccinate almost 16,000 people in one weekend, and to understand that every car that went through that line was the potential to diminish the pressure on all of these frontline teams. I think I'm too old now because I'm becoming emotional, and it's like I'm an early grandfather. I'm not even a grandfather yet, but I want to when I see my teammates, I just want to hug them all the time. It's just incredible what they're doing. And so when we have the opportunity to move people en masse to vaccines, it's just we have to seize on it. And so the chance is to take advantage of that. And then, for me, it's about how do we sustain these teammates during these times, because the risk and the duress that they take on each day is unlike anything that they've experienced in their career, just because of the repetition at the highest level of risk and frankly, over the peak, the surge. I mean, the mortality that many of our teammates are having to not only be a part of, but really be the surrogate caregiver for the families in that moment. There's a heavy burden and a toll here that I think will be pervasive and persist beyond the surge that we're experiencing right now.
Thank you. I'll go to you, Allie, and ask, why is it important to continue to wear a mask and social distance after you have been vaccinated?
So, and Dr. Passaretti might even be able to expand on this a little bit more too, but you know, again, we talk about a effective rate, right? Like, so we have 95% effective, and so there's still that 5% risk. So there's still that chance that you could be infected. The virus could still start to replicate, which means you could still spread that to someone. And so I think really until we get to, you know, everybody's heard, I'm sure if you watch any level of the news, like the whole herd immunity type standpoint, until we get to that point and really are able to be assured with looking at numbers and transmissibility and stuff, we still need to act like we could still have it. I think one of the scariest things for me with this virus as a whole is before you even start showing symptoms, you could be contagious, like 48 hours up until you start showing that. So you literally could feel totally fine, but be giving it to somebody else who's not going to fare as well as you will. And so again, I go back to, I still want to act like I could potentially be infected, right? Because I don't want to give it to my 93-year-old grandmother. I don't want to give it to a patient that I'm caring for or talking with. I don't want to give it to another fellow team member. So I think that's really where that importance of that masking, because that's really where some of the research has shown where we can slow or stop the spread is with that mask, and then just being mindful of our distance too. But that's why it's still important.
Okay, thank you. And Lisa, I'll ask you, how have frontline workers stayed safe during the pandemic? How have your frontline workers stay safe?
Yeah, I would echo the importance of the mask. That the simple act of wearing a mask is really how we have stayed safe. You know, we wear our mask and our face shield or goggles with every patient encounter. And, you know, there's not been much flu either. So, you know, doing those things has really proven effective. Most of us have not gotten COVID. There's been a few, you know, healthcare workers that have, and a lot of times that's because they had maybe traveled somewhere, gone to a beach, been in a gathering, that sort of thing. But the majority of us haven't gotten it.
Okay. Mike, anything you want to add?
Just to add on to what Lisa said, it's a really good point. I think if you were to watch the news, you would think that the hospital was the most dangerous place in the world and that COVID's running rampant through the hospital. Well, the great majority of our team members who have contracted COVID got it from, I don't know where, but Lowe's or the mall or somewhere else. They didn't get it here at the hospital. That's, you know, we saw a huge spike just recently over probably the 2 weeks after Thanksgiving, and then through recently we're starting to drop a little bit, but it's because of family gatherings and people getting together at home. That's what I would warn everyone about is that it's your family, it's the people you interact with or don't regularly interact with, who you now become in contact with because of holidays or other gatherings, that have spread the virus throughout not just Charlotte but throughout the whole country.
Okay, thank you. Dr. Passaretti, I'll ask you, what approach has the country, the state, but most importantly Atrium, because we're local, have taken to vaccine rollout, and why? What approach have we taken?
Yeah, so the way the vaccine distribution works, so the federal government distributes it a certain amount to each state based on how much COVID is in that area, population, a number of factors. The state then distributes it to healthcare facilities throughout the state. And they have, because of where we are in the pandemic, so, you know, obviously we just passed the 1 year mark, right, for the first case in the country. And it takes time to produce mass quantities, hundreds of millions of doses ×2 of the vaccine. We're in this current time frame where we have vaccine, which is amazing, an array of hope, but we don't have enough to just say, everyone show up and we're going to vaccinate you. So decisions were made to try to figure out how to best deploy that vaccine to target the populations most impacted and, you know, protect the most amount of people from the most severe illness. So we have seen time and time again that elderly, congregate living settings like nursing facilities, people with other medical conditions, underserved communities, populations of color, where you don't have the ability to kind of stay home and work remotely or whatnot, are hit harder than other populations. So with that, there's a tiered approach to vaccine distribution based on those factors. So in North Carolina, the first tier was healthcare workers who are, in the face of COVID patients, as we've talked about for the past 30 minutes or so, very frequently, and who need to keep our healthcare system running. They're impacted by COVID in the community, they're impacted by COVID in the hospital. And if we run into staffing issues, too many healthcare workers sick, that compromises our ability to care for the community. So very important to protect that group. Skilled nursing facility residents and people that work in that setting, because again, elderly and all living together, very prone to spread in that setting, are the groups included in the first tier. So that is live and active. That group is in process of being vaccinated. The second tier are the elderly population, so over the age of 65, that also is an active tier. And then, so again, kind of chipping away at the highest risk categories. And then frontline essential workers will come next, people with other medical conditions, and ultimately kind of spreading to the entire population as we continue to ramp up supply.
Okay, thank you. And Chris, I'll ask you, what are the challenges for healthcare?
Well, good. That's an easy one. So we can just answer that with that's a yes or no, right? I think it's interesting if you consider that we've been talking about triple aim in healthcare for a long time. And triple aim is really about our ability to improve care, decrease cost, and improve experience all at the same time. And over the past several years, we've been talking about moving from triple aim to quadruple aim. And the quadruple aim would add caring for our teammates and providers. And that COVID has moved that from the theoretical to the practical. And we're at a point right now where, as we've been talking, and as I mentioned earlier, the strain on our teammates and healthcare providers writ large is just too much. And our challenge right now is, how do we continue to invest in our teammates to protect them, keep them safe, but then also understand how we keep them whole? How do we help them with their families and what goes on outside of their work? And so for me personally, I really am concerned about how do we maintain our frontline teammates today, but also what's the post care that we're going to need to deliver after this? Because I really believe, and this is not based on anything, this is completely anecdotal, but I believe there's going to be some post-traumatic impact to our teammates that we're going to have to invest in. And I think that'll take a long-term toll on healthcare as a system. And it doesn't mean that we won't be able to achieve the rest of the quadruple aim of care, cost, and experience, but it will be a dramatic part of it that we'll have to invest in. And then, secondly, it's a matter of how do we right size ourselves, because the cost of care around COVID is dramatic. When you think about that, an N95 mask prior to COVID, first of all, no one knew what it was except for the care providers that wore it in their environments. But now everyone that walks into Lowe's understands what an N95 is. And the cost for that was less than $1 per mask prior to COVID, and it's around $3, $4, $5 a mask during COVID. And the ability for the healthcare system to maintain those supplies, we're talking about millions of personal protective equipment pieces that we're using exponentially more than we ever used prior to 14 months ago. So there's some significant impacts to healthcare that will continue to resonate. What we're striving for, and I'm sure our partners at Novant are in the same way, is how do we continue to live out our mission, health, hope, and healing for all. And really, this applies extra pressure to it, but it's our challenge to continue to live that out.
Okay, Chris, I've heard you talk before, and you mentioned something about the conversion to virtual care.
Yeah.
And changing, and you want to mention anything about that before I go to Mike?
Well, it's and I'm sure others can tee this up well, but we've seen a dramatic conversion to virtual care. And it really is a matter of, when you look at the first piece of it was when we shut down in April and May of 20, we really disinvited people from really accessing care that was anything but emergent or urgent. And when you think about your regular clinic visits to your physicians, many of those were converted to virtual visits at that time, or at least a large percentage. And so the way that physicians and patients are more comfortable communicating and dialoguing and caring for one another through that virtual environment, I don't think that's something that we're going to get, the genie's not going to go back in the bottle. I think people are used to accessing their care provider through their phone now, and that's something that we'll probably see that will be a higher demand in the future. Mike, I'm sure you probably have a lot of experience with this too, but it's just a matter, it's a dramatic conversion that we've seen.
Okay, good answer. And Mike, because this is so important, I'm going to ask you the same question. What are the challenges for healthcare?
Yeah, and I'll just add on to what Chris was saying around the virtual. I mean, look at this meeting we're having right here. Every year we've done this at the hospitals, and we've shown you around and given you tours, and we're doing it here. And I think it's still maybe not as effective, but nearly as effective. And the same is the case with virtual visits, and people are finding alternate methods of getting healthcare, and a lot of times it's our ability to do this, there's Allie can talk more than I can about the Tarte machine, and you have your own basically your own little healthcare kit where you can show the provider your ears or your blood pressure, and you can do that for them virtually. So that's out there, and that was very it wasn't well used prior to COVID, and now it's the norm. So there are those things. Lisa in the ER can tell you that, our volumes of the numbers of people who come to the ER have dropped by, 10 or 20%, because people who had relatively minor things before would come to the ER and fill up the ERs with that. But now they're realizing that they can go to their primary care, they can do virtual visits, they can go to urgent care. And so the things and Lisa will tell you she is just as, if not more busy than she was before, because now the things that are coming to the ER are, true emergencies. And so we're seeing that. The effect on healthcare long-term, Chris mentioned it, I think we're going to continue to see alternative methods of care around things like virtual care and how to do that. I agree with him too that psychologically, this is like I've heard people say that COVID is like a sprint for healthcare, a marathon for healthcare run at a sprinter's pace. So we are taking care of patients and dealing with life and death and illness at a rate that you would do if a bus crashed and came to the ER, but we've been doing it for a year. And so that's really put a weight on the healthcare provider. So I think long-term, we're going to continue to see that. I think we have stretched our healthcare muscles for the last year. And, when you work out for a long period of time, your muscles get tired. And so we're tired, and we're ready for a little bit. We're going to forever continue to take care of the community. We love to do that, but it would be nice if we could kind of go at a marathon pace instead of the sprinter's pace for as long as we have.
Okay, I feel so good. I have teed up my questions to tell a story, and you guys are talking about something before I introduce the next panelist to talk about it. So Allie, I'm coming to you. Mike mentioned technology. How have you utilized technology during the pandemic?
So just like all of our other partners, we've really expanded that virtual platform. We have mobilized forces to be able to assist our patients and our patrons who may need additional IT support, because not all of us are savvy with that. I always joke with Mike, like I'm technically the millennial on the team here, right? But like I did not get the technology piece of the millennials, right? Like I'm not good with it. My dad at 63 is better with technology than me. So I think, in the beginning of this, when we shut down and we didn't see some of the volumes, we were able to put some manpower into helping support our patients with the virtual platforms and the IT piece, and even with our physicians with getting them more comfortable. And to Mike's point, he brought up Tyto, and I actually it's going to be hard to see, but like, so this is what Tyto is. It's like a little screen. I don't know if y'all can see that real great. But there's a plug in the back, and you get little attachments. So like, everybody's probably familiar with this. Your doctors use it to look at your ears, right? Or in your nostrils. So that plugs into the back. And so at home, this would connect to like your normal Wi-Fi, your iPad or whatever. And then there would be a connection as well to your physician that you're seeing. So they could literally, you could be showing your child's eardrum and they could diagnose an ear infection. There's a piece that looks just like a little kind of knob. They can listen to heart tones. They can listen to breath sounds. And so, you know, to really complete a decent assessment for somebody who has COPD or congestive heart failure, like you can do that virtually. There's even a piece like this, and there's a little tongue depressor piece that you can slide in and they can examine your throat. I mean, so just the fact that we've got that capability, and it's been there all along, right? Like, but sometimes getting the engagement, getting the buy-in, putting the resources into that was difficult. But because of COVID, it was a necessity. And so we were able to really push that out there, get buy-in, get people to try it. And I think there's going to be people, and we're already seeing it now, they're going to stick with that. Like if I can go see the doctor and not have to get in my car, if I don't have to get dressed, I can just wear my yoga pants and my t-shirt. Like, absolutely, they're going to take that route. And especially with our younger population too, it's all about convenience and ease of access. And so this just further expands that. I think it's also going to make it more impactful for even being able to reach people in rural areas where it's difficult to make the drive in, or maybe they don't have reliable transportation. So you're able to get them these devices. And so even in our underserved populations, we're gonna be able to get things out to them as well, so that they have the same access to healthcare that anybody else would. And so just, you know, really bridging that gap. One of the things we focus on a lot too across the healthcare continuum is health equity. And so this is another way we can use the virtual platforms to really bridge that gap and decrease the inequity that we've seen historically. So I think that's just, you know, that's a neat thing that we have that I think is just going to continue to grow even once COVID's not there anymore, because it's, people have seen the benefit. We've seen how many people we can reach. They've seen how easy it is. And so I think that's something that's going to continue.
Okay. And Lisa, I'll ask you, why have wait times in the emergency departments increased?
I don't know if any of you have gone to the emergency department in the last year or not, and if you have, if you experienced a longer wait time than usual. But you know, there's been an increase in people who are being admitted to stay overnight in the hospital. And then they're also staying longer. So whether they used to stay a day or two, they're staying 3, 4, 5 days. Hospital beds are near or at capacity, and that causes a logjam effect into the emergency department. So if there's patients waiting on inpatient beds upstairs, they end up what we call boarding or holding in the ED until a room comes available. But this is not just at our hospital, this is at everybody's hospital. The critical care beds are always full, and there are sicker patients waiting in the ED, either for a bed at the local hospital or to be transferred to a higher level of care. The time it takes to clean a room after a suspected COVID positive or a known COVID positive has lengthened, meaning the room has to sit empty before anyone can go in and clean it for up to 90 minutes. So you could be sitting on 4 or 5 rooms that are just waiting to be cleaned while your lobby continues to grow as patients check in. It takes a lot more time now for the nursing staff to go in and out of rooms because we have to put on gowns, gloves, masks every time we enter the room of a suspected COVID patient. And this all creates additional time and increasing wait times.
Okay, thank you. Dr. Passaretti, for you, you know, we receive a lot of calls because we're community engagement and we're out in the community and people are always asking, when is it going to be my turn with the vaccine? When is it going to be my turn? Can you talk a little bit about the approval process and why rapid doesn't mean rushed?
Yeah, so, one of the biggest concerns I hear about people that are hesitant to get the vaccine is that, this happened way too quickly. There's no way that anything produced in that short a time in a year is safe. Steps were skipped. This is being pushed out, that the safety and efficacy isn't there. And, would just push back against that mindset a little bit. None of the safety steps were skipped in the development of the vaccine. So it still went through, what we call phase 1, phase 2, and phase 3 trials for the vaccine to get approved under that FDA emergency use authorization. The reason it happened more quickly than we're used to are a couple. So first, the entire world scientific community was working together to make this happen. The type of technology that these initial vaccines are, mRNA, has actually been around for about 25 years, used for other treatments, other vaccine trials along the way. So there has been experience with them previously to build upon. And, usually pharmaceutical companies kind of tiptoe into vaccines. They want to make sure that they don't put too many millions and millions of dollars into production before knowing kind of the impact. So there were zero funding kind of blocks. There were no red tape in the approval process. But what was kept consistent, so, it happened quickly, but that's because of a removal of barriers. The vaccines were absolutely held to the same standard that any vaccine would require for approval. So the threshold that's set for how effective a vaccine has to be is 50%. These vaccines are 95% effective at protecting the individual who's vaccinated. And then, the rates of adverse events associated with the vaccine have to be not significantly higher than the people that got the placebo or fake vaccine. And all of these vaccine candidates that have been approved met those criteria and exceeded them. So, I know it's scary, and I know there is a lot of politicization and a lot of background noise that made the science get lost a little bit in it, but would just kind of reassure people that, it's honestly amazing to me as an infectious disease physician how effective these vaccines are, and how we've now given, within Atrium, we've given, I think, probably today over 70,000 doses. Over 12,000 healthcare workers have gotten both doses, and across the country, millions and millions of doses. And, the rates of side effects, even with those millions and millions of people being touched, remains very low, which I think is reassuring. So, the science is solid. There's reasons that it happened quickly. It's because we were all working together, which, doesn't happen all the time. And, I would just kind of reassure people on that front, because I know it's the number one hesitation for a lot of people in getting the vaccine.
Okay, speaking of hesitation with efficacy and safety, I'll ask you, Ali, are Novant team members required to receive the vaccination?
This is something that I get asked. In fact, I went to Starbucks yesterday to get a drink, and I had a patron stop and say, "Hey, are y'all being forced to take the vaccine?" No, we are not. I know a lot of healthcare agencies have taken the stance on, we want to set the precedent, right? We want people to be educated and be informed and take it on their own decision making rights. And I've really appreciated that. I mean, I think that in and of itself has helped people feel comfortable taking the vaccine, to the fact that we're not forcing it. But no, we're not requiring our team members to take the vaccine. Again, we're doing a lot around education to our team members. We're doing, there's like Mythbuster sheets that are out there that people can look at. There are seminars and Zoom sessions that we're holding to talk through what people's concerns are, and what, the truth behind the research is versus what you hear in mainstream media or on social media. And so that's how we're really trying to encourage our team members, is through education, not through, forcing.
Okay, not meaning to sound redundant, but I am an Atrium Health teammate. So Chris or Dr. Passaretti are Atrium Health teammates required to get the vaccine?
No, it's completely voluntary, and we've supported that. Now we're actively trying to recruit and make sure that everyone moves to the queue. Allie, you were talking about myths, and one of the myths that's going around is that my hair was like Bill's before the vaccine, but that's absolutely not true. So.
Yeah, that's something that comes with years of hospital administration. I can speak for that, Chris.
Okay, Mike, anything you want to add to anything we've discussed thus far?
No, I think you guys have spoken well to it. I think, and just a stat, 90+% of our physicians have either scheduled or have had the vaccine. So what I would just say is if our docs are willing to do the vaccine, it's a safe thing to do.
Dr. Passaretti, will you agree with that from a physician's perspective?
Yeah, absolutely. And, the way the vaccines kind of got phased out, focusing on those directly caring for COVID first, I had people like physicians out in the community knocking on my door every day, like, when can we get this vaccine? Like, there are people that are like, and Chris mentioned the Speedway event last weekend. I gave vaccines during that, and there were people literally crying to get the vaccine. It's very emotional and moving to be involved in that process. And I would say for sure, physicians' acceptance of the vaccine is extremely high, and they are all on board and want it as soon as possible.
Okay. And because we're going to get to a lighter note, because the COVID vaccine and just everything surrounding the pandemic is a little heavy, Chris, I'd like to ask you, what is Atrium Health strategy for the North Market, since that's what we're focusing on, with this call here?
Thanks. It's a great segue. So first, we should say, what's our North Market? So the North Market for Atrium Health is really above 485, although it does include University City, and it includes the north end of Mecklenburg County, Cabarrus, and Stanley counties. And the Cabarrus facility, our University City facility, and our Stanley County facility. The strategy for our North Market is really to continue propelling health, hope, and healing for all across this market. And it's, again, we've talked. We do compete, but I'll tell you, our competitors do a fantastic job. I mean, Mike and his team have done a fantastic job of building a really strong healthcare presence in what I consider the North Market. And the rapid growth in the market, it just continues to outpace the assets that we have in all of Charlotte, Mecklenburg region. So Atrium Health is really excited about our opportunity to participate fully, and that includes the expansion of our physician practices and up to and including hospitals. But it really is a matter of health, hope, and healing for all, Kewanda.
Thank you so much.
Mm-hmm.
And because we have some juniors on here on the call, Chris, I wanted to ask you, and then I'll ask Mike, what are the most important attributes of successful leaders today?
Well, so early on in my career, I thought it was, achieving. And really, when I say achieving, I was talking about work product, so if I had a task in front of me, I was going to continue to knock down walls until I got it done. What I realized a little bit later on in life is that it really is about emotional intelligence. And I'm a physical therapist by trade, so for me, it starts with the relationship. But I think if you look at some of the conversations we've had today, and we talk about the impact on our teammates, for me in healthcare, the ability to seek first to understand as I walk into a situation leads to success. And what I would share with everybody is just begin with that. So whatever your work is, if you start with that, it's going to put you in a place where you're going to be able to achieve much greater success for yourself personally, but also for your organization.
Okay, Mike, I'll ask you the same question from a senior leadership perspective. What are the most important attributes of successful leaders today?
I think Chris makes great points. I think for me, it's bringing the best out of people. I say this all the time. I could be a genius, which I'm not, but I'm only one genius, and I'm not a genius, but I'm only as smart as one person. If I can leverage all of the knowledge and the experience and the know-how of the people around me, it will inevitably be much better than anything I could ever come up with. So really kind of fostering that strength in everyone that's around me. And then in healthcare, I think, in anything, but certainly in healthcare, the why is the thing that should motivate people. So why do we do this? Why is it important that we do this? And for us, it's the patient, right? If you can't get excited about taking care of people, then you're probably not going to get excited about much. And I think, in healthcare, if you, in other industries, you may, I just said this the other day, you may put widgets together and you may put a mean widget together, but it's hard to get motivated around why you're putting that widget together. But what we do in healthcare, whether you're the finance guy or the physical therapist or the nurse or the doctor, you've got a really great why, and that's taking care of people.
Okay, so what I want to do is I want to graciously thank all of you, Dr. Passaretti, Lisa, Allie, Chris, and Mike. I want to thank you so much for sharing time. And I know some of you may have to hop off in a second or two, but I wanted to open it up to Bill so that the junior or adult leaders in the cohort can ask questions before our panelists have to get off. And I know Dr. Passaretti, you said that you may have to get off, but could you come back on? Bill, is she able to join back after she makes a couple of calls and join in with Jeff later, or how do you want to do this? But it's up to you now, but thank you guys so much.
Sure, that would be fine. I'll continue to watch, and those of you who have to drop off, if you can come back on, I'll make sure you come back in. And Allie, I'm very excited to hear about the technology coming on board. I want to know when we have simulated colonoscopies, because I'm looking forward to that rather than the actual procedure itself. But that's pretty fascinating about the virtual technology coming on board to be able to do that from home. That's really cool. What I'd like to do is first with the juniors, I know we have a number of students that are on, and do you have any questions of our panelists? We'll go to the juniors first. Any questions from junior leadership, Lake Norman? Okay. I feel like when we did the what are you looking to get out of the Chamber's leadership program, it was pretty swift then too. Well, then let's go to the adults. What questions do we have from the adults of our panel? I know somebody's got a question.
And Bill, if someone wants to put a question in the chat, I'll monitor if they don't want to speak out. If they just want to put it in the chat, I'll look.
Sure. Pat, Jeff, Lindsay, anybody?
I'll say, even if there's questions that aren't COVID or vaccine related, just healthcare in general, we don't have to stay on topic.
Someone just chatted. You did a great job explaining everything.
I'll go ahead and ask a question.
Okay.
I'd love to hear your thoughts on the best way to go ahead and register to get a vaccine.
So I think there's a few ways. From a Novant perspective, if you're already a Novant patient and affiliated with us and have a MyChart, then if you're in some of the already active groups, you should be getting messages around, are you interested? Here's your times, sign up for a date. If you're not, I think Atrium's doing a similar thing. Correct me if I'm wrong, Chris, but I think if you're already a patient with them and sign up with theirs, then that'll send you a message. If you're not affiliated with either or don't have the MyChart accounts, you can either set that up or go through the health department and reach out through them, and then they can assist. They'll validate where you're at in the phases, and then they can give you the letter that you're approved to go and make your appointment, and then they'll work through that to get you set up.
I would echo that. It's, for Atrium, it's myatriumhealth.org. And Allie's absolutely right. You're not going to be allowed access to the vaccine until we go through the phasing that the state has established. This isn't really a matter of Novant or Atrium. It's just a matter of managing the process. But I think personally for me, I think it's a good idea for you to sign up on both Novant and Atrium sites and just have full access as it comes online. I would facilitate if, my mom lives in Ohio, and I got her signed up on Myers and Kroger and everywhere that there was possible so she could get in the slot. And it's not a matter of us trying to self-select. It's just a matter of we just don't have enough access yet and the phases are not open deeply enough. So just be prepared. Understand that if you sign up on our website, we're going to get information to you as quickly as possible.
Okay, and I just want to add that my teammate, Matt, my director, he just posted the Atrium Health website. So you can go into the chat room and click on it and it'll take you there. And then I also want to add that I think Lindsay Smalls, her mic isn't working. She might be one of the juniors. She said that she wanted to say thank you for the information because she wanted to admit she was on the fence about the vaccine, but understanding the process that we have had and the resources to put it together for a while makes her feel much better about getting the vaccine when it's her turn. So that's just to let you guys know you've done a great job with explaining the pros about it. So
Lindsay's part of our adult program.
she's adult, okay.
I will just say that I've had a number of people that are Chamber of Commerce members that have said that they've already had their shots, first round, some of them already the second round, that have said that it was a very smooth operation, that went really, really well, and logistics were handled very, very well between Atrium and Novant. So hats off to both of our healthcare partners.
Yeah, I think Chris mentioned it earlier. We compete in all kinds of ways, but when it really comes to taking care of the community, we are one big unit to make sure that we keep the community healthy.
Okay, and Mike just posted Novant's link as well. And if you have any physician questions, Dr. Passaretti just popped back on the screen. So she's back if anybody has any particular questions.
I see that Vaughn has a question. Vaughn, you want to go ahead and ask your question?
Yeah, I'd like to ask a question about the vaccinations as well. I think there's a Johnson & Johnson vaccine that's being presented at the moment. Does that one need to be refrigerated like the other 2-dose ones, or is it going to be easier to roll out, and what's the efficacy of that one?
Yes. So can you hear me? Yeah. The full data on Johnson & Johnson is due to come out next week. So I think we're all eagerly anticipating that. Huge benefits of that vaccine in that what's going in front of they studied a 1-dose and a 2-dose version. What's going in front of the FDA is a 1-dose version, which you all know the challenges of getting 2 doses in an entire population are not small. The cold chain requirements that are particularly bad for the Pfizer vaccine, a little bit better for Moderna, again, aren't there, as you said, so it can be stored in the normal refrigerator, so much more accessible to people, in addition to being the one shot. The preliminary stuff I have heard about the efficacy is that it's likely to be a little bit less than the mRNA vaccine, so not at that 95%. Sounds like it will be pretty good against these other strains. So, it's a trade-off, right? Like efficacy versus ease of administration, getting it out to more people. In my mind, slightly lower efficacy, but ability to vaccinate way more people, that's still a huge win, but it will make, on the part of the people on here distributing the vaccine, figuring out what goes where and how to do that, it makes this, vaccine dance that we're doing even more challenging. But I think promising, and not long after that, we anticipate AstraZeneca's, which the J&J and the AstraZeneca work by a different mechanism than the 2 that we have right now. So we'll give people another, that have concerns about mRNA, another option, and add to the pool of vaccines that we can give people. So, I think we will continue to see an evolution of this vaccine story, and there will end up being multiple candidates, all with kind of pros and cons that we're going to have to educate on, figure out how to use to best advantage and whatnot. But really good question.
And I think on the nice piece on Dr. Passaretti mentioned earlier, the impact on underserved populations. And when you think about 16,000 people driving through the Speedway this past weekend, you had to be able to drive through the Speedway to get there. And we have a lot of our populations that don't have access to vaccine distribution yet. And the exciting thing about a Johnson & Johnson single dose that doesn't have the extreme cold is you could pretty quickly start to see a lot of different distribution channels that would open up.
Kewanda, we have a great question from Catherine Murphy. She said, what are some general things hospital practice that had to change due to COVID that will stay after COVID?
I mean, I'll start. Oh, sorry. I was just going to say, the virtual stuff that everyone talked about before, that's not going away on a number of fronts. We use virtual care to get physicians, specialists into places we would never have had that before. As far as patients having access and using virtual and e-visits, at Atrium, we have a hospital at home where people that in the past would have required admission to the hospital can now be cared for in the comfort of their own home, with paramedics and paramedicine going out to bring supplies and checking in virtually. I think all those things are here to stay. I personally think masking for flu season at a minimum, and maybe masking in general, will be much more prevalent, not just for people that aren't vaccinated or whatnot. We've seen the huge impact. I forget who mentioned it earlier, but we've had essentially zero flu, which I believe is largely attributed to masking and social distancing in the community. And I suspect in healthcare, at least for the next several years, that may stick around for a bit. And then the learning to do things differently. There were a lot of these things have been discussed for a long time and been like, oh no, that's too expensive or that's too problematic to do. And we showed healthcare in general, Novant, Atrium, that those obstacles can be overcome, and it is possible to do a lot of things differently than we have in the past. So, even just that mindset change, I think, will live with us for a long time to come. From my
Okay, I think Case Maddox, she said that she has a question, and then we'll get to I think Nicole's next.
Yeah, that's me. Just a quick question about the future of COVID-19. Just if there are any, do you guys have any contingency plans for any potential, what was it again? For any potential evolutions in the disease and new strains that come out? How much would that affect the current system if that were to happen?
Yeah, I mean, if there's anything that, and I don't mean to kind of monopolize, but that seems kind of my gig. If we've learned anything over the course of COVID-19, is flexibility and adaptability, and that, whenever you think you're getting things under control, that tends to change. So, certainly the ability to pivot, approach, and whatnot will be important. I do think the preventive measures, regardless of strain, regardless of whatever, it comes down to having a protective vaccine and then personal protective equipment protocols, staying home when you're sick. So, the basic tenets of protection, regardless of what is going on with COVID, as far as strains, as far as twists and turns that disease throws us, are the same. And I think there has been a ton of work, and Chris and, Mike and Allie can probably speak to it more, but we have dealt with very, very high volumes of patients hospitalized with COVID and found how to deal with those surges and ebbs and flows of patients beyond what we had seen traditionally, whether that's, figuring out what accessory areas can be used for patient care, how to care for patients differently, all those things. I think the base is there, and it has the ability to flex and deflex as needed with kind of future changes with the virus.
Okay, and Dr. Passaretti, go ahead.
Sorry, Kewanda. Yeah, I think this is a great question. Really, one of the pieces for me, and this is a little Pollyannish, but I would love for us to move beyond this political moment and start to understand that COVID it's a national disaster that requires personal accountability from all of us. And at the end of the day, I have a disastrous situation in one of the hospitals today where the family believes that COVID is a hoax and doesn't believe that the patient has COVID. And the impact of that is it goes far beyond that family, and it starts to look at, if you look at, and Katie, don't let me get too far out on a limb here, but if you look at COVID-19, it's a SARS-MERS virus, and it's a a variation of viruses that we have seen already. And the reality is that there are thousands of these viruses that have yet to be discovered and could impact us in the future. Our ability to not only survive that, but also be able to thrive as a community is to understand how to move in that environment and how to protect one another. And far too much time was lost in this ridiculous conversation about, is it a hoax or what is it? And I can tell you, Mike, I don't know if you've had this experience, but I take it extremely personally when people have that presentation, because my team is at risk. And we have lost teammates to this disease. And when I walk around and I see people committing themselves in such a selfless way at the highest risk of their career, I don't have any tolerance for it. And so for me, I think we need to, I would say to you, the chamber, and you, the junior chamber, is this is something you can help us with. Rise above this noise and chaos and just start to lend into that we've got to take personal responsibility and accountability for protecting ourselves and our neighbors. So that's my soapbox. I'm going to mute myself now so I don't go any further.
No, don't mute. Dr. Passaretti, Nicole has a question. Do you think children will make it back to school this academic year with the current trends we are seeing regarding COVID?
Yeah, that's a tricky question. More and more information, and it's changing a little bit with, the changing administration and CDC and whatnot. Schools have not, typically with respiratory viruses, schools and children are a huge spreader of infection. COVID is different in this way that we have not seen that as much. Kids certainly can get affected, kids certainly can get hospitalized and, be spread, but they don't do it as efficiently as adults do. And they, that they're relatively less hard hit. So, I think we're not, and the concern, obviously, kids all grouped up in school, you're going to see tons of spread. It's going to spill into adults and higher risk populations. But the reality is that hasn't happened as much as we feared it would, at least as of yet, and hard to know how these new strains may impact things. I do think that more and more schools will tiptoe back into in-person learning or some combo of in-person and virtual. And, I think as an infectious disease person, my initial thought was, no, why would we ever do that? But there's such benefits to the children to in-person school as far as social development, and this again is one that tremendously impacts underserved populations who don't have easy access to virtual tools to do education, that have food and resource issues that may impact them disproportionately. So I think that the balance may swing to a little bit more in-person school. We're on a bit of a downturn now as far as cases, still significant community impact. But I think as we get further out from the holidays, as we get more vaccine into the community, and hopefully as we get more as a community on the same page as far as protective measures, that all those things may work together to get at least some areas back into school. But there is a community responsibility to make that happen. That means getting vaccinated, masking, avoiding the social gathering.
Okay, you just almost answered Pat Meyer's post. She said, Chris, you mentioned earlier about corporate initiatives that are trying to help ease the load on frontline medical workers. Apart from masking and doing our part to stop the spread, what are things that non-medical people can do to help those medical workers to ease their burden?
And I'd say what the community response for our teams has just been immeasurable. And throughout the past 12 months, when I look at the amount of meals that hundreds of thousands of meals that have been purchased by our community members and donated to teams, that's something that has a material and significant impact for those frontline workers. This past weekend, but over the last week or two, we donated, I think it was a total of about $11 million that Atrium Health invested in our teammates in DoorDash coupons. And, it's interesting, throughout my career, I've seen us give flashlights and, t-shirts and hats, and the DoorDash coupon had so much more meaning for people because they're tired. And, to Katie's earlier point, when you have to juggle your kids on remote learning and what's going on, just having the ability to not have to worry about a meal was significant. So there's small ways, and I think just saying thank you. We've had community members show up and just stand at the sidewalk and clap for our teammates as they at shift change, and those are meaningful and material ways to support people. And then again, carrying the message of let's wear a mask and protect one another. Case, thanks for wearing that mask.
And if I could add to that, Chris, everything you said is exactly the same for us. I would say keep it up. I think what we saw in the very beginning of COVID was huge community support, and I don't think our team members had to pay for lunch for 3 months. And I think after a period of time, COVID kind of got old and irritating. And I think as the reality of COVID hit Mecklenburg County, people became more and more frustrated and irritated with the disease, with the restrictions, with everything that came with it, and maybe let a little bit of that out on our team members. And so just remember, they're just as tired as you, if not more so, and just to continue that appreciation is greatly appreciated for our team.
I would tag onto both of those just from a personal standpoint, and seeing what some of my nurse managers and team members have gone through is healthcare workers absolutely suck at self-care. Like, we are just horrible at it, right? And so what we're really good at is compartmentalizing and suppressing, and that works in short bursts. But to Mike and everybody else's point, like, this has become more of a marathon, right? And so, and just like what Chris said, one of my biggest concerns after all of this is what mental health issues our healthcare team members are going to have. So one of the things that's been very impactful for me, and what I've seen for others, is like, instead of some of my friends calling to like fuss about COVID or ask questions, a lot of them have taken time to say, how are you doing? What can I do for you personally? I mean, because we're all, it's like, what is that, 6 degrees of separation, right? Like, all of you guys probably know somebody in the healthcare field that's living this. And so even just doing kind of that pay it forward or ripple effect thing of like calling up somebody and be like, hey, do you need a vent? What can I do for you? What can I keep your kids for an afternoon so you can go get a massage? Can I do a day of virtual learning for your kids? I mean, and it doesn't even have to be that. That's just things that, like, for me, because I have 3 kids in elementary school. I mean, this virtual schooling stuff has been even more taxing on me than I think some of the COVID in some ways, because I'm not a teacher. So if any of you guys are in education, like, God bless you, because I couldn't do it. But, my parents have really taken on some of the burden. I've got friends, like, I woke up one day to $10 in my Venmo account for me to buy coffee, because some of my friends know that I live and die by my cup of coffee in the morning, right? So I think sometimes it's those little things that mean the most to us, just as individuals. And it's really that mental health piece that I'm, again, the most worried about. Like, food's great. So please, if that's something you want to do, like, healthcare people are not going to turn down food. But, at this point, because of it being that marathon, it's really about self-care. And so how you can really push some of us to do that and partake in it. And it's not going to be easy for some of us. I am the worst. Like, if you were to call me up and be like, hey, can I keep your kids one night? I'm like, oh, maybe not tonight. Like, I'll kind of like push it off. But I'll tell you, like, I've gotten to the point now where I've learned, like, me and my husband, if we're going to make it through this, like, I'm going to need a date night. So, like, somebody's got to keep my kids, right? Like, or I'm going to end up divorced too. So, I've learned to accept that help, but it wasn't an easy task for people to get me to that point. So I think reaching out to the people that that are in healthcare, really offering them, even from a personal perspective, something that might be meaningful for them from a mental health piece, is something that non-healthcare individuals can do. And then again, being educated and informed, and help educate and inform other individuals around vaccine benefits, and just encouraging that piece, because I think that's the biggest piece to this puzzle right now. to be able to get this under control and get us back to a little bit of normalcy.
Okay, Nicole, are you ready to babysit before I go to Arjan's question? For Allie, you can babysit. Arjan wanted to know, do you think that the vaccine rollout is going to have to become drastically more efficient to have a chance at returning to some degree of normalcy in a reasonable amount of time? And Dr. Passaretti, that was addressed to you.
Yeah, I think the state of North Carolina tried to be very, the initial rollout was very strict tiers of people, way more so than, what's happened over the past couple of weeks, and not, with good intent, but it kind of hamstrung healthcare systems a little bit from getting a significant amount of vaccine out. I think, the best thing that could have happened is they made those categories significantly broader and gave more leeway to do things like mass vaccination events. Because to your point, like trying to do it teeny tiny bites at a time is going to take us a really long time. So as much as we can employ, and we're limited by vaccine supply, which is still absolutely the case, but as much as we can employ, large scale vaccination events, big, get a lot of people through in a really limited amount of time, in my opinion, that's the way to get it done with the types of vaccines that we have. I'm hopeful that that can get more dispersed and more kind of in the hands of a lot of clinics, a lot of pharmacies, as we get these other vaccine candidates. But with what we have right now to make the biggest impact, I think getting it out more efficiently is absolutely important.
Yeah, and if I could piggyback onto that, I think a lot of what you see and hear in the news today is kind of blaming one side or the other. So if it comes out too slow, it's this organization, it's this administration's fault. If we over protect people, we're ruining businesses. I think you can't win if you're a politician today. You can't get the vaccine out fast enough, and you can't protect people enough, and you can't get people back to work fast enough and back to schools fast enough. So I don't think there's a politician out there who wants to have people die, and I don't think there's a politician out there that wants to keep people from working. But there's just such a tough balance. I would just warn everybody or caution everybody from blaming one side or the other, because I think everybody's trying to do the right thing for people.
And know that there's no right answer, right? Like everyone literally, I've never been in a meeting in the past year where it's not how can we keep the most people safe, without discussion of finances, without discussion of silos across healthcare systems, health department, any of those things. Everyone has a good intent. It's just really, it's not, there's not a clear path. We've had to adjust as we learn, as we get more information. So giving each other grace is super, super important across all levels.
All of my career, I've wanted to mirror Chick-fil-A in healthcare. And this weekend was the first opportunity for us to really achieve that. And when I went to the Speedway, and of course I got to see Dr. Passaretti out there, giving shots. But that was as close as we can get to maximum efficiency. And really, we had people who were in cars who timed themselves through the process when they entered into the Speedway, and it was like 31 minutes to get through and drive out. It was really remarkable. And then when you realize that 16,000 people over 3 days, that's about 0.1% of the population of the greater Charlotte-Mecklenburg region, and when you consider the 16 county region. And so it's going to take a lot of these events for us to really have the impact that we want to have. The other side of that is, the public struggles with, we're not doing it fast enough. And what I'll tell you is it's been really tough to balance, because we don't have enough nurses and physicians to staff the beds for the patients that are, in our care areas. So when we're taking providers from those spaces and putting them in vaccine clinics, it really, it overmaxes the entire system. So this weekend was incredible because we had, all of our pharmacy teams, we had primary care physicians and pediatricians and obstetricians that were coming in to volunteer outside of their clinic to give injections, because we just can't take people off the front line to treat the patients that are in front of us.
I'll say what's really heartwarming. I don't know if you guys are seeing this at Atrium, but we're having a lot of retired healthcare individuals reactivate their nurse. Like our professional support service director, her mom, who's 84, reactivated her nursing license and is now employed with Novant to do vaccine clinics and stuff. So I think too, what we're seeing, just, you know, we talk about some of the heavy and the negative, but I think we've also seen a lot of the all in and people coming out of the woodwork wanting to do even outside of what their normal would be. So that's very encouraging and inspirational. I think it's just amazing that people are wanting to do that and to just support and be a part of that solution, right? Like so many people want to be a part of the solution, that it's just, it's amazing. But it is a lot of work, and it is, you know, figuring out some of those logistics have definitely been interesting, to say the least.
And Bill, I know that time is getting close for us, but I wanted to tell you that from a collaboration standpoint, thank you for allowing Lisa, Emilee, and I to lead this panel together between Novant and Atrium, because this really is a community effort, you know, for everyone. And I just want people to understand that.
Kewanda, you did a masterful job today. Congratulations.
Oh, thank you.
That was fantastic. And Emilee, Lisa, thank you very much for putting this on. Thank you to the panelists. We look forward to continue working with you, and great job that you're out there doing. Thank you very much on behalf of all of us. You don't have to jump off, but we also have Jeff Tarte. Jeff Tarte's going to be chatting with us. Jeff is one of the co-chairs of our Lake Norman Healthcare Collaborative. And I wanted Jeff to be able to share what is the Healthcare Collaborative and what do you hope to achieve. So Jeff, you want to share a little bit about that?
I do, but I want to address a few points that were made on this session. Just as background, my wife is the medical director for the virtual pediatric hospital in Atrium. So at any given point in time, they have about 1,500 kids right now around that have COVID. So to speaking to Chris's comment, COVID's real. There's no ifs, ands, or buts about it. And I would just a couple quick facts why to get the vaccine. There's been in the US alone over 429,000 deaths. There's been 0 from anyone getting the vaccine. And Allie, you made a comment, and I may be taking this out of context, so I want to be careful here because you made a comment, I wrote it down. You said young not surviving the virus. And I didn't know if that meant from all things, the virus itself, but the virus is not near, and the physicians will be better positioned. But healthcare has been my whole background as well, industry-wide. I've worked in hospitals and clients in all 50 states and 5 foreign countries, and this is an amazing thing. But kids under 18 do not have the same exposure. They may be, because we don't know. We won't know the after effects of having it. But to date, there's been, as an example, almost 9,000 people have died from COVID-related deaths in North Carolina alone. We've had 2 kids under 18 die in the entire state. One was an 8-year-old, which was ironically on my daughter's Teams watch over at UNC Hospital. She's 29 in her second year of pediatric residency, but the severity of the illness is nowhere near as dangerous. It doesn't appear, because the stats support 2 kids as it is. So young not surviving the virus, I don't want people to come away thinking it's much more deadly, because it's not.
Right, and so I didn't mean pediatric. You know, I think at the beginning of this, people had the impression that it was more our elderly, older, with comorbidities that were struggling or not surviving. And we've definitely seen a shift where it's, so you get like 37, 44, minimal comorbidities. That's what I meant with that phrase.
And that's good, but it's still, I think one of the things that everybody needs to recognize with any kind of pandemic or something like this, because one of the funny things, ironic funny, not hilarious funny, always relate to, was people saying, well, why didn't we have the vaccine ready to go when it came out? Well, it's hard to prepare and create something for something you know nothing about until it happens, right? And the fact of what these professionals and knowledgeable people around the globe have done is nothing short of the human experience of ordinary people doing extraordinary things. So just, I think those are important as we see and going forward, but we still, 1/3 of all the deaths to date have occurred in elderly that are in communal settings, nursing homes, SNFs, continuous care community. So it's still, that's the highest at risk population, and that we need to be sure we're protecting and taking care of. As far as the healthcare collaborative is a concept that's trying to get legs, that we've been working at for a little bit over a year. And the construct around it is really a population health management initiative to a large extent. I think of ourselves primarily as a medical think tank. A focus is to leverage technology as we go forward. We were talking about that a little bit earlier. And what the intent is looking at data and using data analytics, what we all hear about as far as artificial intelligence and machine learning, where we get posture taking clinical data, which comes out of hospitals and doctors' offices every day in the forms of things that you get into a little bit of minutia, but 835s and 837 data that goes from the hospitals to the payers and how they get reimbursed, and it lists all the care and things that were provided. We want to be able to take that data and do predictive analytics for early identification of diseases with an initial focus around the most survivable cancers, if you will. We've got issues with ocular melanoma up here, some thyroid issues that we've looked at environmentally that have concerns in the northern end of the county, but things like breast cancer, colon cancer, those types of diseases or cancers. If you identify in stage 1, they have, 80–85% survival rates. If you do not identify those diseases until stage 3 and 4, those numbers invert. So we absolutely believe technology and using data has the ability to provide information to care providers that can save lives at a very minimum, and thousands of lives on a national scale, but also have the ability to reduce healthcare costs, impact employers because people can stay productive and work through. If they can get, again, treatment earlier, the invasiveness of the treatment required is a lot lower. So it's got positive benefits all around as we do that. We are continuing to get into a couple of other areas with this, with the collaborative. One is there was an initiative about 2.5 years ago around developing an all-payer database, which basically is looking at capturing all data on everybody as a repository. There was a formal task force by the state. We've been in contact with the co-chairs and some of the participants. The only reason, and that had grand support, bipartisan support, because it's going to require legislative initiatives and the Department of Health and Human Services being involved to move that forward. One of the reasons why it did not move forward at the time is because of resource availability to get behind it. And then COVID happens, which even pushes it further down, because as we all know, COVID is kind of taking all the oxygen out of the room, if you will, as we should be focused. So that will be an area that we move into, is hopefully around leveraging that data. So that's kind of the 20,000 foot level of what the collaborative, both hospital organizations have been involved and supportive of what we're doing in the community, as well as a lot of the other regional hospitals. We have been in conversations with collaboratives in other states, most closely working with Vermont and Colorado and the initiatives they're doing. Some of the other collaboratives have a little bit different missions and focus, and we're working with the national collaborative out of New York City as well. So, and we function and will function as a not-for-profit. Our intent is to take everything we're able to eventually glean or use and help and give it right back to whoever can benefit from that information, whether it be the local providers and taking care of their patients and us in the community, or whether we're giving it and sharing it with other collaboratives and cross-sharing knowledge gains so we minimize reinventing the wheel, sharing funding sources and things like that that we're working on as well. So that's a little bit of that.
Any questions from any of our juniors or adults about the healthcare collaborative, or going back to our panel discussion?
Or stop.
Or any other questions? Well, again, I want to thank Kewanda and Emilee and Lisa for putting this together, Jeff, and all of our panelists for being a part of the day, all of our juniors and adults. We have recorded this, so but we had about, I think we had at one point 30 people participating, so that probably covered a great many of everybody that was going to be on the call. But we have recorded it, and I'll push it out next week to anybody that missed a call. If you are part of the Leadership Lake Norman program, either now or in the past, you want to come up to Lost Worlds at 5:30 and join us, we'd encourage you to do that. But again, thank you everybody for participating today.
Thank you. Thanks, Chris. I appreciate it.
Thanks all.
Bye-bye.
Thank you.
Bye-bye.
Thank you all for coming.
Thank you.